now to Albury Wodonga, to the Albury Wodonga Aboriginal Health Service, and welcome to you, Ricky. Can you introduce yourself and tell us how long you've been a client of the service there in Albury Wodonga?
Hi, I'm Ricky Williams. I've been with AWAS for about 15, 16 years. On and off, my partner comes here, my children come here.
Tell me, what sort of cancer did you have and what sort of treatment did you get?
I had rectum cancer, and I had chemo for 24/7 around me, and then I had radiation for 6 weeks. And because it was right on Christmas and they wanted to sort of do it twice a day, they did it at 8 o'clock in the morning. And then I went back at 3 o'clock in the afternoon again and did another bout of it. And that went on for 6 weeks. And then they went in and operated, took the blockage out, the tumour out. And then I went back for another 6 weeks of radiation and chemo. And we've just about got it, I think, at the moment.
How long ago was that, Ricky?
About 5 years ago or more, a little bit more now.
Tell me about the different help that you got from the Aboriginal Health Service.
I had people drive me wherever I had to go. Fiona sort of took over everything as far as making the appointments, answering to the appointments. All that sort of thing was all sort of bypassed around me myself, so I didn't have to do any of that. Even the transport was supplied for me, so yeah, it took a great burden off my... And that's what I was saying before. I can't understand how these older people actually do it without a partner or something like that, you know.
Did you ever have someone from AWAS come with you when you had appointments? Did someone ever come into the appointment with you?
Yeah, quite often Fiona would pick me up and take me over to my appointments and things like that, and she was an advocate for me as far as even hospital. She'd come in on several occasions to help me in hospital and things, and even after the cancer. Since I've had the cancer, I've had pneumonia a couple of times. And just one experience, I went up to the hospital and they were going to discharge me, and Fiona actually stepped in and stopped them, and it was 3 weeks later that I actually got back out.
What you're describing, they sometimes call navigation, you know, that helping with appointments and so on. If you hadn't had that help, who would have made your appointments and kept track of them all for you?
I have no idea. I honestly don't know, because, I mean, I got appointments 5 minutes after they gave me an appointment, mate. I had no idea. AWAS always sent me out me reminders and things like that, so I was always ready to go, you know, when I was being picked up and things like that. But I would never have made it by myself, no way in the world.
If someone's watching this, Ricky, and they've never visited an Aboriginal health service or really met anybody who uses them or works at them, how would you describe that service there? What does it offer people? What's it helped you with over the 15 years?
Well, mate, I mean, from time to time, they've even got food in the waiting room, you know, like you can pick up some peaches or some oranges, something like that. You don't see that in a normal doctor's surgery or anything. And it's not run like... It's a bit different to like a normal stuffy doctor's surgery, eh? It's sort of a bit more relaxed and things like that. And so I find it quite homely in that.
And what makes it seem homely and relaxed? Can you think about it?
You get to know everybody. You know, it's not like you see one doctor scooting through or anything like that. You know most of the doctors and you know most of the people because they're either the drivers or one of the doctors or one of the counsellors or something like that. Have
you ever had any other sort of, services through the Aboriginal Health Service?
Yeah, I just had all my teeth done. And I'm just waiting on my denture now. Well, that only cost me $300, which it would have cost me with a private practice. It would have cost me about $1,200. So, yeah, they've done a lot for me as far as that goes.
That's fantastic. I just think having the dental care there is, why is that important to you?
Probably just vanity.
Well, there's nothing wrong with vanity. Is there anything else you'd like to say about your experience with cancer and the health service? This is all about trying to talk about closing the gap so Aboriginal people have an equal survival rate and equal recovery.
Yeah, well, I was watching a guy the other day here at actual AWAS. He was trying to get through to one of the girls out the front about an appointment when she said, I have to make it for a week's time. And she was so diplomatic the way that she went about it. This guy wasn't accepting the fact that he had to wait a week for an appointment. But the young girl behind the counter, mate, she was so diplomatic about it, eh? And the guy ended up having a bit of a giggle by the time he left, where if he'd been in a normal doctor's surgery, mate, they would have got quite perturbed with it and thrown him out.
It's been fantastic to talk to you, Ricky. Thank you so much.
Thank you very much, eh?
And I look forward to seeing you with your new teeth. My dad was a dentist.
Thank you. I hope your future's good for you too, Doc.
Well, welcome now to Fiona. Fiona, can you introduce yourself?
My name is Fiona Bradbury. I work for Albury Wodonga Aboriginal Health Service as the Chronic Disease Coordinator.
Tell me the challenges that many of your clients face when you're supporting them to get through the cancer.
So basically the obvious challenges for people is cost. It's about the financials. It's also about how they're going to get to the appointments. How do they remember the appointments? So that's where my role comes into it. That's my job. I coordinate multiple appointments, whether or not they need x-rays, allied health appointments, specialists. I also work with the primary health network and I'm able to fund consults. Transport is offered via our Aboriginal outreach worker or AWA's transport.
And why is transport so critical, particularly in a rural area like Albury Wodonga? Explain where Albury Wodonga is for our national audience.
Albury Wodonga is on the border of New South Wales and Victoria, and the Murray River runs between it.
Would you have many patients who are travelling distances for their cancer treatment?
Yes and no, because my role actually goes up to the northeast region. So I have patients in Wangaratta and Benalla. So yes, that was quite challenging at times to get people to their oncology reviews. So again, I rely heavily on my chronic disease outreach workers to do the transporting for me. So I work under the umbrella of a program called the Integrated Team Care Program. So this is a program run through the primary health networks, and I'm very fortunate enough to sit in the AMS. So with this program, it is exactly that. It is about closing the gap of ill health of Aboriginal people and recognising that chronic diseases are actually in fact killing people if left untreated. So what that looks like, it's more than cancer. It's about respiratory disease, it's cardiac, it's kidney disease, it's diabetes and cancer. So we are able to have funds to get people to specialist appointments. We are able to provide transport. We are able to liaise, advocate for our patients, attend appointments with them.
Fiona, you have a number of services coming in from outside, don't you? Tell us what agencies come into the Aboriginal Health Service.
We have a legal service that visits weekly. We also have a representative come from housing. We also have somebody coming from Centrelink. And this helps people because, saves them going and waiting in long lines. They have access to make appointments here. And so, for example, Centrelink can get online immediately and access their files from our service.
When I visited Albury Wodonga Aboriginal Health Service, the architecture and design of your service is absolutely remarkable.
AWAS is an amazing building. It's quite beautiful and homely. So when you enter into the reception area, it basically is divided into two, and it's kind of a rounded horseshoe around a beautiful garden. So when you go to your right, you're in the social and emotional wellbeing team, which is where our counsellors, mental health workers, our outreach workers that assist with drug and alcohol. We have an NDIS support coordinator in there as well. Then when you go to the left of the building, that's where our clinic is. So we've got our GPs, we have our practice nurses, we've got a child and family health team as well, and we've got a midwife as well that looks after our pregnant mums. We have access to allied health as well, which is fantastic, full allied health. So we have our diabetic educators, our podiatrists, speech pathology, we've got dietitians. We also have a physiotherapist that's here once a week as well. Basically, AWAS is a one-stop shop. We also have visiting specialists as well that come here. We actually have a psychiatrist that comes here, a nephrologist, and a paediatrician.
Well, Fiona, thank you so much for talking to us for this program. Thank you.
No worries, thank you.
Well, we're joined now by Megan. Megan, can you introduce yourself and tell us what you do there at Albury Wodonga?
Yes, I'm Megan Clayton. I am the Aboriginal Chronic Disease Outreach Worker.
And what does that mean, outreach worker?
Well, in a nutshell, I assist patients with appointments to specialists. I work alongside Fiona in her role. So I take them to their appointments as needed, sitting the consult with them as well, and go from there, help them on their journey.
I'm very interested in how you help people to both to understand and to remember what's happened. Can you talk about that a bit?
Well, usually I sit there and take a lot of notes. I do, because I have had that experience where the person has stopped listening after you hear the C word. So I tend to take a lot of notes. So afterwards, I'll sit down with our clients as needed and go over the information again with them, just to see what they have missed, what they don't understand. If they do need to chat with their doctor again about what's going on, then I'll organise that as well.
And tell us about the transport. I know there's a practical element of just getting the person to appointments on time, but there must be a big emotional support role in that too, is there?
Yeah, it's actually really good transporting the clients, because I get to know them on a more personal level, because we don't just talk about cancer. We talk about other things, what's going on in their lives, and that's where you can pick up other issues they're having, whether it be social and emotional wellbeing stuff or something the social worker might need to assist them with. And that's a really good opportunity then, or just generally how they're feeling, you know what I mean? Like emotionally, you know, they might be more likely to have a chat with me than they are with their partner or someone else.
Have you got any thoughts on what more we could do to close the gap? You know, what are there challenges that your clients are facing and you think, golly, I wish we could do more about that?
From what I've seen, like going to the cancer centre here, and I did actually originally go to the Wodonga one as well, and I was only discussing this earlier, I think we need more Indigenous workers in these places, you know, because a lot of our clients do see an Aboriginal face and it is a relief.
And tell us a bit about yourself, your own background and how you got involved in cancer work and Aboriginal health.
I'm actually a middle-aged Aboriginal woman. I'm Radri. I grew up in Wagga, and Clayton. I actually started out in childcare and then got the opportunity to do an Aboriginal traineeship for enrolled nursing in Wagga. So that's how I started the nursing side of things, and then I got a job at the AMS in Wagga in the chronic disease role there as Care Co-ordinator. So that's how I started off there, and I've worked in chronic disease now for about 10 or 11 years within the Aboriginal community. So, and I love it.
Well, look, thanks so much for talking to us. It's an absolute pleasure to hear about your work, such vital work and in our efforts to close the gap. So thank you so much.
My pleasure. Thank you.